Microdose infusion is probably the most exciting topic that I have to talk about this summer. Not that the others aren't important, not that they're not good. They all have a place, but as you see, the core metabolic issue in all of our health and just life itself is regulating the energy production inside the cells. Inside the cells, as you'll see, there's these little energy powerhouses called mitochondria that are required for all the living things that we do. There's an article that came out, this was just a couple months ago, that seemed a little all that. This was not by anybody associated with our group. This was not about anybody associated with MDI or any of the group of people I've been connecting with lately doing microdose infusion. But this is a representation of a mitochondria inside the cell. And the term that's being used is retrograde mitochondrial signaling. That's a bunch of fanciness, but that's the term that's being used in the regular medical literature for what we're talking about MDI does. In summary, I just pulled out some salient points and I'll read them, but it's activating the mitochondrial integrated stress response. So there's many mitochondria inside the cells, and I'll show a little bit later what that looks like. But they all work together. There's many mitochondria in each cell. But that elicits this chromatin remodeling and that causes mitochondrial retrograde signaling, and therefore it's the promising treatment of prevention of, and these are key words, metabolic disorders. This was just published in February of this year, and it was in Science, and I actually went to, I have the reference here. If you're available, I can get that to you later. Okay, let's go to the application real quick, and then we'll back up to what a little bit of the science is. And the purpose of this talk is to give you a brief overview, hopefully in lay English, but I needed to give some evidence of why this is even a thing, how it happens, what it does. And any of the other therapies that we do, whether it's ozone or whether it's chelation or whether it's vitamin support with Myers cocktail or IV vitamin C, those things are all supportive of this core treatment, this core issue. This is a case report of a patient who we know of a condition called retinitis pigmentosa. If you don't know what RP is a condition that kind of seems to be genetically linked. It's a progressive disease. There's no known cure, and it gives people low, slow, progressive loss of vision. MDI has a treatment for many people with RP. This is the case of a patient who at the age of 49 had discovered MDI was a thing that she could even try. She was able to, she knew that she had RP in her teens. She recognized that she was going to go blind. She, in December of 23, had progressed or had been to the point where she had really no depth perception, no night vision, no peripheral, and very, very narrow. She couldn't drive, she couldn't function. She was effectively blind, totally blind. In doing MDI treatments, within a series of 3 or 4 treatments, she was able to completely reverse her blindness. Where she had night vision, she was able to drive her car after 3 treatments. This isn't a miracle. This is just applying the principles of waking up mitochondria that have gone to sleep or gone dormant, as I started off with in the first slide. In Alzheimer's and other types of dementia, we see the same type of thing happening with mitochondrial fatigue, mitochondrial dormancy, or the loss of the energy production inside the cell. And the effect over that of time, as you can see here on scanning, is a progressive loss of function. I mean, we know people who have various types of dementia. This is a case here, a young man who had an acute change. He was a teen. He was playing semi-professional tennis in Mexico, got heat exhausted, collapsed, and ended up in the Mexican hospital for 2 months. For 2 months. He was unable to feed himself. He was unable to move. And they had pretty much said, we don't know what in the world your problem is, except that he had a brain scan, that showed what doctors know as encephalomalacia. His brain had essentially just kind of turned to gel, is how they described it. They said that's not good enough. They were able to get him to Texas Children's in Houston and went through a battery of consultants, tests, and the same thing. It's like, you have this, we don't know why, we don't know what to do about it. And as God would have it, he would say, because I've talked to him myself personally, there's a picture of us together. He said, I think God saved me to talk about MDI, because after 2 weeks of therapy, 2 weeks of treatments, his system was able to ramp back up, and he was able to get out and walk and go and feed and do all the things that he should be able to do. If you look very closely, his eyes are slightly divergent. He's not 100% normal. So this isn't like this miracle cure, but it is like that. And he was able to get to the point where he is going in the next couple weeks to Italy to participate in a tennis scholarship and do international business school. And he is very positive, very encouraged. He still does MDI to keep things going, but really, essentially, he feels normal. He does all the normal things that a older teen does. MDI has been studied in neuropathy. The same similar thing happens in a lot of cases in neuropathy, even though if there is a toxin, a heavy metal, there's some chemical, even if there is something that's interfering with normal nerve function, the root issue with neuropathy, or pathologic nerve sensation, pain, tingling, that's the classic symptoms, is that cells don't have either some sort of oxygen flow or nourishment to get the normal cell function to happen. So they've got a large study, which I'll go over in a different talk. When they've looked at treating patients, it's a very high success rate. If it were a drug, the FDA would prove it. It's not a drug, and the FDA is probably not going to touch it. There are studies in people with all types of cardiovascular disorders, people with end-stage heart failure, people with just hypertension that are responding to MDI. In treating patients with chronic kidney disease, they have a lot of data that folks are able to avoid a continued loss or drop in their creatinine clearance, and folks that have actually approached the actual dialysis with their kidney function have been able to be not to go on to dialysis and actually regain some of their kidney function. We don't see that there's 100% reversal of the kidney function, apparently in the studies, but it is absolutely impressive to stop the progression and to cause some regression of diseases. This was that study, 46% less blood pressure requiring patients. Vascular wounds, absolutely incredible. And the other talk that I'll do is a lot deeper dive. There's some very nasty pictures of wounds. Doing traditional care, we're about to be required to have an amputation, whether it's a mid-foot or foot or lower extremity, whatever amputation. MDI alone, along with just standard physical therapy or wound care, caused absolutely amazing healing of their wounds. Here's one small, not so gross picture. You can see on the left there a toe that's gangrenous, really needing amputation, and after several treatments, I don't know in this particular case how many they got, but we have a normal toe. Gross, not going to stay here very long, but bad on the left, better on the right. Parkinson's disease. Patient who was formerly bedbound and unable to move, after 4 treatments, is able to get up and walk around. You know, we don't know what the long-term effect of restoring mitochondrial function brings about, but we know it's good things. We don't know how well someone's going to come back from the condition that they're in, but they only have upside. This is a patient who had actually diagnosed as a mitochondrial function disorder. So no label like any of the other labels, just we know that she had mitochondrial dysfunction and then having seizures and improving quickly over time. We see effects in muscular dystrophy. I didn't know that MD was a mitochondrial disorder. I mean, I thought it was a neuromuscular disorder. I thought it was just the nerves and the muscles don't talk anymore. And then they get muscular wasting because they're not using their muscles. But it is now pretty well known that Duchenne muscular dystrophy is a mitochondrial disorder. They can't, the nerves can't do the things the nerves are supposed to do to send the signals to the muscles to work like they're supposed to. This is a success case where bedridden begins to walk again. ALS, amyotrophic lateral sclerosis, or Lou Gehrig's disease, same thing. Bedbound, almost, he looks like he's dead but alive, and able to get into a chair, having some leg movement, hand movements after just 3 treatments, when there wasn't anything for months and months and months. I got texted a case this morning while we were doing treatment of a different ALS patient. I'll just share that. This is a lady who is able to sit up and get around with assistance, but she's had 6 treatments and is still on tube feedings. She still is not able to talk. She still has weakness, but she has more strength. She has some swelling in her feet, pins and needles sensations, and all the symptoms are just one-sided. So she's still doing, she's on her 6th treatment today. So it is effective. We don't know how quickly some people are going to recover versus other people, but we see that everybody improves. Another ALS patient came in a wheelchair walking after 2 sessions. This is at a treatment center in Los Angeles. This is a genetic disorder called Anderman syndrome, and he reports, all the functional difficulties that he have are 70% improvement after just 3 sessions. I got to see not this, but another patient who has COVID pulmonary fibrosis, who has 0 shortness of breath, who's maintaining their O2 sats, still on some conventional therapy. That's not contraindicated at all with any of the MDI treatments, but able to go out without oxygen on now. That's a big deal. Able to be ambulatory, drive, do self-care. Diabetic macular degeneration and legally blind in 12 years, improvement in 16 sessions, and able to walk without assistance of a human cane or his white cane. He's able to see well enough to walk around and get around now. And that's without injections, with the eye injections that we know of for that. MDI is used in adjunctive care with breast cancer or any type of cancer, diabetes, cirrhosis, neuropathy, just general confusion. We don't even have to necessarily know the diagnosis, but give the body what it needs and let it do its thing. There's been many successful clinical trials published worldwide in the literature, and there's been 0 failures because everybody gets some improvement, to the degree of which is all varies, and there's been no major adverse events. The device is registered with the FDA and have to do annual reporting, and guess what? No major adverse events. Because it uses insulin as an infusion tool, The only side effect that we see is usually hypoglycemia, low blood sugar. We will deal with that with every patient. It's something that we actively deal with. And the patient that we treated today, we used about 3.5 or 4 units of insulin over the course of 3 hours. So we're using microdoses insulin, and it's not just give them that amount, but it's the application of how the device, when we program it, we program it and reprogram it several times throughout the procedure so that it gives what we call a pulsatile release. In the deeper dive talk, I'll share with the Nobel Prize winners about 25 years ago who discovered that our pancreases release insulin in a pulsatile manner. This mimics that, the way that the pancreas does that. And even though you don't continuously have a patient hooked up to IV, to microdoses of insulin, it will trigger an effect that causes cell signaling or mitochondrial signaling, as I covered in the very beginning. Those mitochondria that have been dormant in these genetic and these chronic disease states, those mitochondria wake up. They are activated again. Retrograde signaling causes them to come back online again. What happens in the mitochondria is oxygen production. They're able to use sugar or glucose for the fuel source instead of fat burning, and it's a lot more efficient. It's a lot more ATP or energy currency production, and the cell's able then to do whatever that particular cell was planned to do, like a nerve cell do nerve things, a heart myocyte cell do heart pumping, the lining of the blood vessel cells to be healthy and to do the things they're supposed to do, i.e. lower blood pressure, increase blood flow, and to deal with any cholesterol inflammation that's happening on the plaque wall. So the thing we're not saying is that it's a miraculous cure. What we're saying is we are helping the body get the proper signals to be able to wake up and do the things those cells were intended to do. The machine's used in many other countries around the world. We currently have active centers. I say we because now I'm part of a MDI group, have active centers in several countries, the biggest of which is Puerto Rico and Mumbai, India. But there are smaller centers, as I've already mentioned, in Los Angeles, one in Florida, one in Iowa, a new one here and in Hobbs, New Mexico, and then a larger one here in Houston nearby. They've had over 500,000 patient sessions easily, of no events, no hospitalizations, no deaths, because you're actively managing and monitoring these patients for one thing, and that's blood sugar while you're doing the treatment. Let me tell you about the treatment process. We hook up the machine, program it with a certain amount of insulin. I already told you about how much. The patient gets a 3-hour treatment, and then that's divided up into lots of little teeny tiny sessions within that 3-hour treatment. The machine runs for 1 hour at a time, but we program it, and within that program, it has 10 6-minute sessions that it's doing the pulsatile release. So it's triggering the body to do its thing. This is a guy who had been given a final, you're not going to live more than a few months, and his testimony is he's better. This is Daniel again. All you do is sit there and you're going to eat and eat and drink and eat, and we'll give you sugar, and we'll do that because it will drive the blood sugar down. Doing even the teeniest amount of IV insulin, and it's similar to a patient that's, say, in ICU, and they're getting a infusion of insulin, but the manner in which this does it affects the cells differently than just a constant continuous infusion. So we have many other talks we're going to do in this summer series. This is a list. The MDI therapy is the microdose infusion is the root issue or the root care. But you need to, again, our theory is to give the body what it needs in optimal amounts and don't give the body what it doesn't need. That's toxins, that's all types of chemicals, all types of things that don't need to be in or on our body, and let it do its thing. God programmed us to heal, to regenerate, to fight cancer, MDI is a very, very powerful tool to help the body do just that. Thank you.